and I'm program coordinator with the Lawrence County Cooperative School. We serve programs during the day for approximately 35 individuals that live in northeast Arkansas. We provide training for these adults in daily living skills. There's times when we have crisis areas, we have to wait several hours before we can get help. And from what I can see and what we have experienced in the past, we need more mental health services in this area.
I'm Sandy Babel, and I'm employed with the Lawrence County Cooperative School in Portia, Arkansas. We recently had a situation with one of our adults that we had to remove them from our group home, and we needed a behavior management plan. In this rural area, no one can provide that service for her. We wound up having to go to Central Arkansas, and didn't even succeed there. They said they couldn't provide one for us. We're just at a real loss sometimes for help, the help that we really need to help these individuals.
Hi, I'm Dr. Fuge.
And I'm Dr. May.
I grew up in a rural area, Grove Springs, Missouri, and when I was growing up, I remember that we had to travel over 100 miles just to be able to see a physician. And during that time, there was not a lot of psychologists around, and found that a lot of people were struggling trying to find services. So I decided when I finished school that I wanted to come back to an area and help the people who were like us.
I also, like Dr. Fuge, grew up in a rural area in Oklahoma. Our population there was, there's probably about 300 people in our town. I knew when I started the profession that providing service to the rural areas and getting services out there that people can get to easier was definitely something that very much motivated me and knew I wanted to do from the start of my professional career. One of the things we realized is our mission is very much consistent with the NHSC, and so we started researching that and started the application process to become members with them, because we very much share their goals in providing services. Our application process, again, we started in January. I think we started applying and filling out paperwork in February, and we found out last month that our site has been approved.
Mansfield's a real small community. We have about 1,200 people living in this town. We provide services to a lot of different types of people. Majority of them, probably 95% of them, are on Medicaid or below
poverty level. Dr. Fuge and I started this clinic here in January of this year, so it's very short-lived. And even when we were talking about our name,
we decided to call our clinic Real Psychologists and Associates because we wanted to let people know that we were out there in the rural areas and willing to provide the services. We service about 7 counties of people.
7 different counties, yeah. And have people driving in an hour and a half away to get services here. In fact, we have several saying that other services they have to drive to that they can't get in except once every 2 months.
Right.
And so for therapy and stuff, and it's been taken off pretty good. I mean, we've got a lot of people excited that we're in the area.
I'm Steve Akeson. I'm a licensed psychologist in Missouri, and I've been practicing for about 10 years now. And I had already been working in rural areas, coming from a rural area, and in the course of working in these areas, found out about the NHSC through their ambassador program and was accepted. Our practice primarily does assessments, and I go to 3 different small towns outside of Springfield, and then I also have an office here in Springfield. So we provide services to people from over radius of over 200 miles from this central location. We feel that we're providing services to a very broad area in about 6, 7 different counties in this area. I was born in western Nebraska. My dad's a farmer, and so I grew up in an area that was underserved. They closed the hospital in our town when I was in grade school. So I'm used to the idea of underserved areas and the difficulty in recruiting professionals. When I was in first grade, we had a substitute teacher who decided that I was ADHD. Eventually, they were able to find someone to do the testing, but it took almost a year to find someone to come in and actually test me. And when they got done, they decided that I wasn't ADHD, that I was gifted and probably a little bored, which was a better outcome, I guess. But in the process, I became interested. It was my first contact with psychologists. I became interested in the field, and so the opportunity for me to go into that and to continue to work in small areas has been something that I've been proud to be able to do.
My name is Robert King, and I'm a licensed psychologist at Robert J. Murney Clinic at Forest Institute. We have a dual mission here, and one of the missions is to serve the underserved population of Southwest Missouri and the Greene County area. And then the second part of that mission is to train graduate students. So we have a really good sliding fee scale that actually starts at $7 per session on up to $55. And through the work of our students, our graduate students here, and also the providers that we have here through the National Health Service Corps, we're able to meet that mission. 70% of our clientele are actually employed. So we service a lot of employed individuals who are part of the workforce here in this community that otherwise wouldn't be getting mental health services. 89% of those of the clientele here at this clinic actually have no insurance, so they may be employed without any insurance, or they may be employed and be underinsured. So they come here and they can pay on a sliding fee scale and actually be seen for mental health services. So I believe that our dual mission, both in the training aspect and a focus on the underserved, serves this community as a whole. So I believe that we are meeting not only the mission of this clinic, but also the mission and the purpose of the National Health Service Corps.
I'm Dustin. I'm a doctoral student here at Forest, clinical psychology. I'm also from a very rural area in northeast Arkansas. That's kind of one of the main reasons I got involved in this. I think there's a real need in areas like that, especially where I was at. It was a population less than 500. When I first heard about the NHSC, I was really excited because, part of my goal in the future is to serve places like this, rural areas that are underserved for sure. So I think it's a great opportunity and something that could help people like me move forward and help people like this out, because I still consider it my home in an area that really needs some attention.
When we found out about the NHSC program, we were both really excited because we're both from a rural area, and we both believe in serving underserved populations, being from that area and seeing the great need.
It's just like someone saw the same goals we did, and they're going to allow us to fulfill our goals. Who knew it would be made that much easier by a program with the same kind of, dreams and aspirations that we've got.
I came from a really small town too, probably a little over 1,000 people, and the main profession was farming. So, you were a farmer or you weren't. And so, in ways of health profession, you pretty much just had doctors, medical doctors that you went to if you had a problem, and there wasn't really any type of mental health professional around that I can remember. I can't even actually remember a clinic. So, for most of your people who did have some type of mental illness issues, they didn't get services. Part of my desire and my wife's desire is to be able to go back and serve communities like that.
I want to be able to bring that back. I don't want people to feel like there's nothing out there for them.
NHSC, here I come.
NHSC,
Here we come.
NHSC, here I come.
NHSC, here I come.